So in last session, we got some idea about the serological markers, and here now we will more detailed see what are the markers, basically the test which we do to investigate a patient with hepatitis B. These are the called serological marker. Why they are called serological marker? Because we take blood, separate serum, and then conduct these tests in serum. That is why these are serological markers, right? So typically hepatitis B virus, outer layer we have the blue one is the surface antigen, then the inner one, red one is the core antigen, and the most central part is composed of DNA. So a virus's component is made of these three things, you can say. Two type of coating and one DNA. Only these things can be used as markers. So one is surface antigen. This is the part of virus. Our body will develop antibody against it. So another marker will be anti-HBs. Second is core antigen. Core antigen is never appearing in the blood, so we cannot test it. It always appears inside the nucleus of the hepatocyte. So if you do liver biopsy and stain that liver biopsy for this antigen, then you will find positivity there, but in blood you will never get it. But body will develop antibody, so you will measure anti-HBC. As Dr. Abhay told, anti-HBC are two types, IgM and IgG. Both of them are appearing almost together. But if IgG is present, that IgM is present, that means the infection has occurred recently, acute infection. If IgG is present but IgM is absent, that means it was a chronic infection, right? So third is in between during the replication process, E antigen is produced. So that is another part of virus and antibody against E antigen. So these are the complete marker. If you see this way, it is easy to remember. And the same I have summarized here. The antigen is surface antigen, core antigen which never appears, and E antigen and antibody corresponding to each other, right? And DNA. DNA does not help us to interpret which type of infection it is. It is basically used to decide your treatment, whether treatment is to be given or monitored or drug is to be stopped or not. But to decide what Dr. Abhay has shown in the last slide, that which group our patient is acute infection, chronic infection, resolved infection, vaccination, we don't need DNA test. We know only these tests, right? Surface antigen, anti-HBs, core antibody IgG and IgM, HBe antigen, and also anti-HBe antigen is also not needed for diagnosis. It is used for more of treatment management for patient. So few tests we are using. What does each test means? Surface antigen means whenever this virus is replicating inside the hepatocyte, surface antigen is produced in excessive amount. Entire virus is not produced. Only surface antigen, mean empty virus particles are produced, which are released in the body more than 10,000 times. For each complete virus, 10,000 or more empty particles are released in the circulation. That much is the concentration, and that is the reason HBsAg testing is the easiest one. So if empty particles are continuously produced, that means infection is ongoing. We can make a sense that person is infected. And considering the high quantity of this surface antigen, because of postgraduates being here, I have added this line that quantitative HBsAg was also used sometime. It was a fancy test few years ago, but it is not of much clinical use. In few patients, it may be useful when we are treating them with pegylated interferon. Otherwise, quantitative HBsAg has no role. It has role when our surface antigen test is in doubt, which is plus minus borderline, something like that, and we don't want to spend money for DNA, or DNA is not available, then we can take help of quantitative HBsAg. Then it can help you to differentiate whether person is really infected or not, right? Anti-HBs, if antibody is present, then antigen cannot live in the body because antibody will neutralize the antigen. So antibody will appear only if HBsAg is cleared. So if anti-HBs antibody is present, that means the person had infection or was vaccinated, and now the HBs is clear. So person will always be HBsAg negative and anti-HBs positive. But it is very, very rare to see, HBsAg positive and anti-HBs positive. Very rare. So anti-HBs is the protective antibody once the concentration is going more than 10 milli-international unit per ml. That means person is protected for life from hepatitis B. He or she cannot have second episode of hepatitis B virus infection, even if the antibody goes down and become undetectable. Because whenever second exposure will happen, antibody will appear very fast, without any booster dose. That is why now booster dose is not recommended after 3 doses of vaccination. Core antigen, already I have told it not appearing, and anti-HBC in develop in those when the person is infected. What we are giving in vaccine, what vaccine is composed of? Hepatitis B vaccine. किसी को पता है वैक्सीन में होता क्या है? सरफेस एंटीजन होता है केवल, उसमें कोर पूरा वायरस नहीं होता है. If it is not a complete virus, so it does not contain core antigen. That is why vaccine will never induce core antibody. It will induce only anti-HBs. So presence or absence of core antibody will help you to differentiate whether this anti-HBs was developed as a part of natural infection or as a part of vaccination. If person was vaccinated, then anti-HBs will be present, but core antibody will be absent. If person was not vaccinated and had natural infection which goes unnoticed and now he has resolved, developed antibody, then core antibody will still be positive and anti-HBs will be positive. So that is why we have to understand the significance of each parameter to interpret really what is happening with the patient. Any confusion up to this point or anything which is not clear, make it clear. Otherwise, it is easy to understand now, and then after 2 hours, everything is blank slate. So IgM and E antigen, anti-HB. E antigen is a marker which what we have learned over the years in MBBS days also is a marker of replication. So if virus is very highly replicating, then E antigen will be positive. Then antibody will be absent. But what happens when a child is infected? Immunity is not good to prevent replication of virus. So virus is replicating freely, very high viral load, and E antigen positive, but anti-HB will be negative because antibody cannot live in presence of antigen. As the age changes, a child become adult, replication of virus is controlled by the immunity of the human being. E antigen become negative and then antibody appears. So again, it is very, very uncommon to find E antigen positive as well as anti-HB positive. One will be positive, another will be negative. In children, predominantly antigen will be positive, antibody will be negative. In adults, predominantly antigen will be negative, antibody will be positive. This is how which time it changes. This is the natural history. Following acute infection, most of the infections are asymptomatic. Most of the infection. We feel that it always causes jaundice, but this is not true. Most of the infections are asymptomatic. It just causes some degree of OTPT elevation, some anorexia, myalgia, nausea. Many of us might be feeling today that थोड़ी थकावट लग रही है, कमजोरी लग रही है. हम जाके LFT तो टेस्ट नहीं करते. उस दिन हो सकता है हमें हेपेटाइटिस बी हुआ हो. So this is what happens in real life setting. So most of the hepatitis B infection in adults goes unnoticed, and a small proportion develop acute hepatitis. They had jaundice, they have liver failure, which are coming to the doctor, and then we diagnose as acute hepatitis B. A small proportion, say 1% of those with acute hepatitis develop acute liver failure, 99% recovers. In adult population, 5% of those with acute hepatitis progresses to chronic hepatitis, 95% clears the virus and develop anti-HBs. So what will be the serological status of the person who has, adult person who has recovered from acute hepatitis B? Can anyone calculate everything and give answer? What will be the HbsAg? Negative. What will be the anti-HBs? What will be the IgM anti-HBc? Positive, negative कुछ भी हो सकता है. What will be the total anti-HBc? Positive. Right? So समझ में आ गया यानी सबको good. So chronic infection, 5% of those from acute hepatitis will progress to chronic infection, and then they will gradually progress to chronic hepatitis B, followed by cirrhosis, followed by hepatocellular carcinoma, decompensation, etc. One point I want to emphasize here: hepatitis B can cause hepatocellular carcinoma without moving to cirrhosis. Without going to cirrhosis, just simply chronic hepatitis B can cause hepatocellular carcinoma. But this is not true for hepatitis C. Hepatitis C always causes hepatocellular carcinoma only in background of cirrhosis. This is a major difference between the two viruses. Why it happens? Basic difference reason is because of the nature of the virus. B virus is a DNA virus. C virus is a RNA virus. So RNA virus never enters inside the nucleus. It will go into hepatocyte and will remain inside only the cytoplasm. But DNA virus enters inside the nucleus, get integrated with the human DNA, and it changes the human DNA. When it changes the human DNA, it causes hepatocellular carcinoma. It does not need cirrhosis. But hepatocellular carcinoma in SCV cannot happen in absence of cirrhosis, because only cirrhosis is the contributing factor, and that is why the risk of hepatocellular carcinoma is much more in HBV than SCV. So this is the pictorial time frame I have shown what happens to different serological marker. On the x-axis, you can see how the time changes, and y-axis is the relative amount of different serological marker. Once the infection happens, at the lower left corner, you can see this is the HbsAg. HbsAg will appear first, its concentration will go up, and then gradually it will disappear. In typical reading is 6 months, but in real life it takes up to 1 year, right? Now what will happen? Once HbsAg has disappeared, then anti-HBs will appear, and this will continue for life. These are the two markers. And in parallel, what is happening here? Immediately after HbsAg, IgM anti-HBc will appear. But please note here that IgG is also appearing at the same time. But IgM will disappear after 6 months, but IgG will continue for life. Now you can understand how the different markers of hepatitis B is going to help you, which kind of exposure our patient had, right? And similarly, parallel, third is E antigen. It will appear first, then it will disappear, followed by anti-HBe. Is it clear? If that appear, then anti-HBs will neutralize the HbsAg. That is the mechanism we are using for giving immunoglobulin to the baby. That whatever HbsAg has been transferred from mother to baby will be immediately neutralized by the anti-HBs antibody given, which is prepared, and it will not stick to the hepatocyte. So वो भी सब मिथ है. वो नेफ्रोलॉजिस्ट सारे मानते हैं कि अगर 100 से ऊपर हो जाए तो फिर HbsAg प्रोटेक्टिव होता है डायलिसिस का. अब हमारा पेशेंट डिफरेंट है इसलिए है, बस वैसे होता नहीं है कुछ, वो 10 ही होता है सबका। ऐसी कोई गाइडलाइन दुनिया में नहीं है जो कहे कि डायलिसिस पेशेंट में 100 होना चाहिए, लेकिन सारे नेफ्रोलॉजिस्ट यही मानते हैं कि उनका टाइटर 100 होना चाहिए। उस चक्कर में उसको हर 6 महीने साल भर में बूस्टर देते रहते हैं। टू मच ऑफ बूस्टर इज ऑल्सो नॉट अ गुड थिंग, इट कॉजेस इम्यून एग्जॉशन, योर इम्यून सिस्टम गेट एग्जॉस्टेड एंड देन वॉट एवर, आप इंजन में कितना भी फिर एक्सीलेटर दबाओ ना, एक लिमिट के बाद तो वो गाड़ी का स्पीड नहीं बढ़ेगा और फिर ब्रेक डाउन हो जाएगा। So too much of booster dose is also not a good thing. So this is the interpretation of what the Abhay had shown. Same thing. If you are getting HbSAg negative in a patient and anti-HbS is negative, that means the person was never exposed. See, I want to give you a concept. There is a difference between exposure and infection. मुझे एक्सपोजर हुआ होगा लेकिन इन्फेक्शन होना जरूरी नहीं है। इन्फेक्शन तब कहते हैं, एक्सपोजर और इन्फेक्शन में ये डिफरेंस है। फॉर एनी बैक्टीरिया और पैथोजन और पैरासाइट वॉट एवर यू से, if the parasite has gone inside my body, that is exposure, but if it is start multiplying inside my body, that is infection. That is the basic difference between the two. If it is not multiplying inside our body and whatever number has gone, it has been taken care by the body and it has moved out, that means it is just exposure. At least for B it is true, very small amount of virus is going in, right? So we are exposed or we are not exposed, that was I'm talking, that is why I'm giving here. If the person would have been infected, then anti-HbS would have appeared. If you are infected with HbSAg, then immunity will come in, but if you are exposed to HbSAg, it's not necessary that your immunity will work. You're getting my point? कार चालू करने के लिए उसकी चाबी को घुमाना पड़ेगा ना, तो जब तक हम इन्फेक्ट नहीं होंगे तब तक वो चाबी नहीं घूमेगी। एक्सपोजर और इन्फेक्शन में ये डिफरेंस है दोनों में, ठीक है? So that is why here anti-HbS is negative, so we can say person is either never exposed or just exposed, never infected at least. If core antibody is positive and anti-HbS is positive, what does it mean? Is it right? Is it explanatory? Infection hua, which has resolved, anti-HbS has appeared, and why we are telling it is not vaccine induced? Because core antibody is positive. Sometime for postgraduate I am extending that sometime this positivity of core antibody is also taken as an evidence, or it is a definition of occult HBV. If only core antibody is positive but no other marker is positive, then again past infection which has resolved and probably the anti-HbS titer has disappeared with age. That is why this antibody is not appearing. Similarly, here only anti-HbS is present, but every other thing is negative, including core antibody. That means it is vaccine induced. Because in vaccine, we are giving only surface antigen, not the core antigen. And this will help you to differentiate between acute infection and chronic infection, because here IgM is positive, you can see. And the last, surface antigen positive, total is positive, IgM is positive, anti-HbS negative, means acute infection which has still not resolved and is ongoing, or it has moved to chronic hepatitis B, right? In chronic hepatitis B, with time, IgM will disappear from 6 months to 9 months, so you will get only total antibody. IgM will also be diminished. Is it making sense? Yeah. He has moved to chronic hepatitis, na? Chronic infection. If acute infection is resolved successfully, body is able to take over the virus, only then antibody will appear. Here body failed to take over and develop antibody. That is why antigen is still circulating. In just previous one, IgM is positive. Here IgM is negative, because with time IgM will become negative, but IgG will remain positive. That will help you to say that he is having chronic hepatitis B. Actually, even without chronic IgG also you can say it is a chronic Hep B. But this is how you interpret taking these parameters and make sense in which stage your patient is. So HBsAg positivity indicates ongoing infection. IgM indicates recent infection, which may resolve in due course of time. Once infection happens, IgG will continue for life. Once anti-HBs will appear only after HBsAg is negative. And to differentiate between vaccine-induced anti-HBs and natural immunity-induced HBs, you have to take help of core antibody.